Question 1. In the context of patient protection during pediatric fluoroscopic procedures, which of the following actions would most effectively reduce radiation dose to the child? Pediatric patient Chloe, age 5, is undergoing a fluoroscopic study for suspected gastroesophageal reflux. Given her young age and heightened radiosensitivity, the technologist must choose the best technique to reduce dose without compromising diagnostic quality. Pediatric protocols are in place, but there is pressure to complete the study quickly due to Chloe's anxiety. Which of the following would be the most effective technique to mitigate her exposure? A. Use continuous fluoroscopy rather than pulsed mode for smoother imaging. B. Increase frame rate to capture more images per second, improving clarity. C. Utilize last image hold and pulse fluoroscopy mode with the lowest acceptable frame rate. D. Position the image receptor further from the patient to reduce scatter. Answer. Correct answer. C. Utilize last image hold and pulse fluoroscopy mode with the lowest acceptable frame rate. Explanation. Children are significantly more radiosensitive than adults due to rapidly dividing cells and a longer expected lifespan. The ALARA principle, as low as reasonably achievable, mandates that all radiation exposure, especially in pediatric cases, must be minimized. Using pulsed fluoroscopy and last image hold feed significantly reduces dose by limiting continuous exposure. Increasing the frame rate, option B, unnecessarily raises dose. Continuous fluoroscopy, option A, leads to increased exposure without meaningful diagnostic gain. Placing the receptor farther from the patient, option D, increases the dose due to automatic exposure compensation. Question 2. As demonstrated by cellular studies, what is the key distinction between direct and indirect action of ionizing radiation on biological tissues? A. Direct action involves reactive oxygen species generated in water radiolysis. B. Indirect action targets DNA directly, breaking chemical bonds. C. Indirect action results from the interaction of free radicals with cellular targets. D. Direct action is predominant in low-level radiation interactions. Answer. Correct answer. C. Indirect action results from the interaction of free radicals with cellular targets. Explanation. Ionizing radiation can damage cells via direct or indirect action. Direct action occurs when radiation deposits energy directly into critical targets like DNA. Indirect action, more common with low-level radiation, e.g. X-rays, involves the ionization of water molecules, leading to free radical formation, e.g. which then damages biomolecules. Approximately 70% of biological damage from X-rays is via the indirect pathway. Question 3. Given the circumstances, what is the primary radiation safety concern when using shielding for pregnant patients during abdominal radiographic procedures? Ms. Alvarez, who is 12 weeks pregnant, needs an abdominal X-ray for severe trauma evaluation. The technologist must ensure fetal safety while achieving diagnostic quality. What is the most appropriate action based on radiation safety protocols? A. Avoid shielding to prevent image artifacts. B. Use lead apron shielding over the abdomen without altering exposure parameters. C. Postpone the procedure until after the pregnancy if not urgent. D. Apply shielding properly and adjust technique factors to avoid retakes. Answer. Correct answer. D. Apply shielding properly and adjust technique factors to avoid retakes. Explanation. Pregnant patients must be protected with lead shielding over the abdomen whenever exposure to the fetus is possible, unless medically contraindicated. However, shielding must not obscure anatomy and should be accompanied by correct technique adjustment to avoid retakes, which would increase fetal dose. Postponing, option C, may be inappropriate in trauma situations. Not shielding, option A, ignore NRP report no. 174 and ALARA compliance. Question 4. During the process of radiation monitoring, what is the primary limitation of thermoluminescent dosimeters TLDS? A. TLDS can be used only once and are non-reusable. B. TLDS require immediate on-site reading after exposure. C. TLDS do not provide real-time dose readings. D. TLDS are inaccurate at high dose levels. Answer. Correct answer, C. TEDS do not provide real-time dose readings. Explanation: TEDS thermoluminescent dosimeters store energy from ionizing radiation, which is later released as light when heated. Their main limitation is the lack of real-time monitoring. Unlike electronic personal dosimeters, they must be returned to a lab for analysis, leading to delayed awareness of overexposures. Contrary to option A, they are reusable. Annealing, they are accurate over a wide dose range. Question 5. When faced with the need to monitor occupational radiation dose in a hybrid operating room, which personnel monitoring device offers real-time feedback and alarm capabilities? A. Film badge dosimeter. B. Pocket ionization chamber. C. Optically stimulated luminescence dosimeter. D. Electronic personal dosimeter. Answer. Correct answer, D. Electronic personal dosimeter. Explanation: electronic personal dosimeters provide real-time dose readings, audible alarms, and dose tracking, making them suitable for high-dose variable environments like interventional suites. Film badges A and OSCELs C do not offer real-time feedback. Pocket ion chambers B offer immediate readings but lack storage, alarms, and accuracy over time. Question 6. With respect to the ALARA principle, what strategy is most effective for minimizing radiation dose during repeated imaging procedures in interventional radiology? A. Increasing KVP and decreasing mass to maintain image quality while reducing dose. B. Using automatic exposure control at its maximum sensitivity. C. Reducing distance between source and patient to increase exposure uniformity. D. Disabling beam filtration to enhance image contrast. Answer. Correct answer A. Increasing KVP and decreasing mass to maintain image quality while reducing dose. Explanation: a higher KVP allows X-rays to penetrate more effectively, meaning fewer X-rays, lower mass, are needed, thus reducing patient dose. This technique aligns with the ALARA principle and is especially useful in repeated procedures like fluoroscopy or CT. Option B leads to overexposure, reducing source-patient distance. C increases skin dose. Disabling filtration. D increases patient exposure to low-energy, non-diagnostic radiation. Question 7. The evolution of structural shielding design in radiation facilities primarily aims to A. Increase aesthetic appeal of diagnostic rooms. B. Minimize scatter radiation to patient tissues. C. Prevent unnecessary exposure to non-targeted personnel and public areas. D. Allow for use of higher tube currents without safety concerns. Answer. Correct answer, C. Prevent unnecessary exposure to non-targeted personnel and public areas. Explanation: primary and secondary barriers are incorporated into facility design to comply with NRP Report 147 and AIA guidelines, aiming to protect occupational workers and the public. These barriers address both direct beam, primary, and scatter leakage, secondary. Increasing aesthetics A is irrelevant. Option D reflects a misunderstanding of why shielding is used. Question 8. While examining a scenario involving MRI and radiation safety, which of the following statements is true regarding the presence of ionizing radiation in MRI procedures? A. MRI uses gamma rays, making shielding essential. B. MRI employs strong magnetic fields and non-ionizing RF energy. C. MRI includes a fluoroscopic component for guidance. D. MRI requires dosimeter used to track exposure levels. Answer. Correct answer, B. MRI employs strong magnetic fields and non-ionizing RF energy. Explanation: MRI does not use ionizing radiation. Instead, it relies on radio frequency RF pulses in a magnetic field to align hydrogen protons, making shielding and radiation monitoring unnecessary. Therefore, options A, C, and D reflect misconceptions. However, MRI safety protocols are essential due to risks in magnetic fields and heating. Question 9. To better understand radiation safety for pregnant workers, which of the following correctly outlines the recommended monthly occupational dose limit for the embryo fetus? A. 5 SE month. B. 0.5 MSE month. C. 1 MSE month. D. 0.1 MSE month. Answer. Correct answer, B. 0.5 MSE month. Explanation: according to SRP Report No. 116 in year SNRC EFR Part 20 once a worker voluntarily declares pregnancy, the fetal dose must not exceed 0.5 msv per month to limit cumulative exposure to 5 msv during gestation. This limit safeguards the developing fetus against deterministic effects such as microcephaly and growth retardation. Question 10. A critical examination of photon interactions reveals that the photoelectric effect is more likely to occur under which condition? A. High-energy photons interacting with hydrogen atoms. B. Low atomic number materials and high photon energy. C. Low photon energy and high atomic number materials. D. High photon energy and high atomic number materials. Answer. Correct answer. C. Low photon energy and high atomic number materials. Explanation. The photoelectric effect is predominant when photon energy is just above the binding energy of inner shell electrons and the target atom has a high atomic number Z as interaction probability will Z. This makes bone more absorbent of low energy photons than soft tissue. Question 11. In a context of radiation protection, Mr. Thompson is tasked with reducing the radiation exposure during a fluoroscopic procedure. He is aware of the inverse square law but is unsure how to apply it in this situation. What should Mr. Thompson do to reduce radiation exposure to the patient? A. Decrease the exposure time while maintaining the same distance from the patient. B. Increase the distance from the patient while maintaining the same exposure time. C. Increase the exposure time to ensure clearer imaging. D. Use a higher dose rate to minimize the exposure time. Answer. Correct answer. B. Increase the distance from the patient while maintaining the same exposure time. Explanation. The inverse square law states that the intensity of radiation decreases as the distance from the source increases. Therefore, increasing the distance between the radiation source and the patient will reduce the patient's exposure. This is the fundamental principle in radiation protection. Reducing exposure time, option A, and increasing dose, option D, would be effective methods for reducing radiation exposure. Question 12. Considering the impact of radiation on tissues, Dr. Williams is evaluating the cellular effects of radiation exposure to skin cells. Which of the following factors would most likely lead to increased radiosensitivity of the skin cells? A. The skin cells are actively dividing. B. The skin cells are in the G phase of the cell cycle. C. The skin cells are fully differentiated and non-dividing. D. The skin cells are more mature and have lower metabolic activity. Answer. Correct answer A. The skin cells are actively dividing. Explanation. Actively dividing cells are generally more radiosensitive because they are in phases of the cell cycle such as the G and G phases that are more susceptible to radiation-induced damage. Cells in the G phase, option B, are quiescent and less sensitive. Differentiated cells, option C, or those with lower metabolic activity, option D, are typically more radioresistant. Question 13. From a historical standpoint, the implementation of shielding materials in radiation protection was primarily driven by which of the following principles? A. To reduce the patient's exposure to secondary radiation. B. To minimize leakage radiation from the X-ray tube. C. To protect personnel from scattered radiation. D. To increase the intensity of the primary X-ray beam. Answer. Correct answer. C. To protect personnel from scattered radiation. Explanation. The primary purpose of shielding in radiation protection is to protect personnel from exposure to scattered radiation, which is the result of the X-rays interacting with the patient and surrounding environment. Shielding is critical in occupational settings where radiation exposure could occur to workers. The other options do not address the core issue of protecting personnel from scattered radiation. Question 14. When evaluating the effects of radiation exposure on the embryo and fetus, which of the following best describes the period of greatest radiosensitivity? A. The pre-implantation period, first 2 weeks. B. The organogenesis period, 2 to 8 weeks after conception. C. The fetal period, 8 weeks to birth. D. The post-birth period. Answer. Correct answer. B. The organogenesis period, 2 to 8 weeks after conception. Explanation. The organogenesis period is when the major organs and tissues are developing, making it a time of heightened sensitivity to radiation. Exposure during this time can cause significant developmental abnormalities. The pre-implantation period, option A, is less sensitive, and the fetal period, option C, generally sees a reduction in radiosensitivity. Post-birth radiation exposure, option D, is typically much less risky than in utero exposure. Question 15. Under the assumption that a radiologic technologist is working in a facility where radiation dose limits are set by the National Council on Radiation Protection and Measurements (SRP), which of the following represents the maximum permissible dose for radiation workers per year? A. 50 MSV per year. B. 100 MSV per year. C. 500 MSV per year. D. 1000 MSV per year. Answer. Correct answer, 850 MSV per year. Explanation. According to the SRP, the occupational dose limit for radiation workers is typically set at 50 MSV per year. Exceeding this limit can increase the risk of stochastic effects, such as cancer. Option B, 100 MSV, and option C, 500 MSV exceed the recommended dose limits for radiation workers. Option D, 1000 MSV, is significantly above the threshold for safety. Question 16. When considering the use of radiation safety measures in the context of radiographic procedures, which of the following would be the most effective in reducing radiation exposure to the patient? A. Using the lowest possible exposure factors that provide diagnostic image quality. B. Increasing the KVP while maintaining the mass. C. Using a larger field size to ensure complete coverage of the area of interest. D. Positioning the patient further from the X-ray tube. Answer. Correct answer A. Using the lowest possible exposure factors that provide diagnostic image quality. Explanation. The ALARA, as low as reasonably achievable, principle emphasizes minimizing radiation exposure while still obtaining the necessary diagnostic information. Using the lowest exposure factors that provide acceptable image quality, option A, is the best method for reducing radiation exposure. Increasing KVP, option B, may dose, but it's not as effective in all cases. Larger field sizes, option C, can increase radiation exposure unnecessarily, and positioning the patient farther from the X-ray tube, option D, is not as effective in radiography as reducing exposure factors. Question 17. The prevailing theory suggests that ionizing radiation can affect cellular DNA through both direct and indirect actions. Which of the following best describes the indirect action of radiation on cells? A. Ionization of water molecules leading to the production of free radicals. B. Direct breakage of DNA strands due to photon interaction. C. Production of secondary radiation that damages DNA directly. D. Creation of electron pairs that cause mutations in the DNA. Answer. Correct answer A. Ionization of water molecules leading to the production of free radicals. Explanation. Indirect action involves the ionization of water molecules within the cell, which leads to the production of free radicals that can cause damage to the DNA. Direct action, option B, involves radiation interacting directly with the DNA, which can also result in damage but is less common than indirect damage. Secondary radiation, C, and electron pair production, option D, are not typical mechanisms of indirect DNA damage. Question 18. In light of recent developments, regulations for radioactive waste disposal are becoming more stringent. Which of the following is the most effective strategy for minimizing radioactive waste in medical facilities? A. Implementing strict disposal procedures for all materials regardless of contamination. B. Reducing the use of radiopharmaceuticals and other radioactive materials. C. Storing waste in temporary holding areas until more advanced disposal techniques are developed. D. Recycling radioactive materials whenever possible. Answer. Correct answer B. Reducing the use of radiopharmaceuticals and other radioactive materials. Explanation. One of the most effective strategies for minimizing radioactive waste is to reduce the use of radioactive materials, thereby reducing the waste generated. Strict disposal procedures, option A, and temporary storage, option C, are important but are secondary to reducing the amount of waste created. Recycling, option D, is typically a viable option for most radioactive materials due to contamination risks. Question 19. Given the circumstances, a radiologic technologist is performing a mammography procedure on a patient who is pregnant, but the patient has not informed the technologist about her pregnancy status. What should the technologist do before proceeding with the examination? A. Proceed with the exam as scheduled, as the radiation dose for mammography is minimal. B. Reassure the patient that mammography poses no significant risk and proceed with the exam. C. Inform the patient of the potential risks and provide alternative imaging options if possible. D. Immediately ask the patient to sign a consent form acknowledging the risk of radiation. Answer. Correct answer. C. Inform the patient of the potential risks and provide alternative imaging options if possible. Explanation. It is essential to inform the patient about the potential risks of radiation during pregnancy and to offer alternative imaging options, such as ultrasound, which might be safer. Even though mammography radiation doses are relatively low, it is better to take precautionary measures in light of the potential risk to the fetus. Options. And B. Dismiss the patient's right to informed consent, and option D is not a sufficient response on its own without full consultation with the patient. Question 20. To determine whether radiation exposure during radiotherapy could lead to late effects, Dr. Thompson is analyzing dose-response relationships. Which of the following best describes a late, stochastic effect of radiation exposure? A. Radiation-induced erythema occurring shortly after exposure. B. Increased risk of cancer developing years after radiation exposure. C. Nausea and vomiting occurring immediately following exposure. D. Temporary hair loss in the area exposed to radiation. Answer. Correct answer. B. Increased risk of cancer developing years after radiation exposure. Explanation. Stochastic effects are those that occur randomly and with a probability that increases with dose, such as the increased risk of cancer. Option B. These effects have no threshold and can appear years after exposure. Early deterministic effects, options A, C, and D, are typically associated with higher radiation doses and occur shortly after exposure. Question 21. During a radiation therapy procedure, the radiologic technologist notices a potential issue with the collimator. Which of the following actions should the technologist take to ensure proper radiation protection for the patient and staff? A. Allow the radiation oncologist to make adjustments to the collimator during the procedure. B. Immediately cease the procedure and notify the medical physicist for inspection. C. Continue the procedure as the issue with the collimator is minor. D. Adjust the collimator manually without consulting any additional personnel. Answer. Correct answer. B. Immediately cease the procedure and notify the medical physicist for inspection. Explanation. Any issue with the collimator could potentially result in an incorrect radiation field or excessive exposure. It is critical to halt the procedure and involve a medical physicist to ensure the equipment is functioning properly before continuing. The other options are either disregard safety protocols or delay addressing a potential issue. Question 22. A patient who is undergoing a computed tomography (CT) scan is concerned about radiation exposure. Which of the following is the best way for the radiologic technologist to address this concern while performing the scan? A. Reassure the patient that the radiation dose for CT scans is negligible and proceed. B. Explain that CT scans use high doses of radiation, but the procedure is necessary for diagnosis. C. Provide the patient with information on radiation risks and explain the benefits and alternatives to the procedure. D. Suggest that the patient decline the procedure if they are concerned about radiation exposure. Answer. Correct answer. C. Provide the patient with information on radiation risks and explain the benefits and alternatives to the procedure. Explanation. It is essential for the technologist to provide informed consent by explaining both the risks and benefits of the procedure, including potential alternatives, reassuring the patient without providing full information, option A, or suggesting they decline the procedure without proper consultation, option D, would not be responsible practice. Option B underestimates the importance of patient education and informed consent. Question 23. In radiation protection, which of the following best describes the concept of effective dose used to quantify the biological effect of ionizing radiation? A. It accounts for the energy deposited by radiation in a specific tissue. B. It is the sum of the doses received by all tissues in the body weighted for their radiosensitivity. C. It refers to the dose of radiation delivered to a specific area of the body. D. It is a measure of the total energy released by a radiation source. Answer. Correct answer. B. It is the sum of the doses received by all tissues in the body weighted for their radiosensitivity. Explanation. The effective doses are calculated quantity used to assess the risk of radiation exposure by considering both the dose delivered to different tissues and the varying radiosensitivity of those tissues. This is different from a simple dose measurement, option C, or energy released, option D, and it is more comprehensive, just the energy deposited in single tissue, option A. Question 24. During a radiographic procedure, a radiologic technologist notices a drop in the machine's output. The equipment is still functioning, but the technologist is unsure whether the output is within safe limits. What is the appropriate course of action? A. Continue with the procedure and report the issue after completing the exam. B. Cease the procedure immediately and report the issue to the lead radiologic technologist. C. Ignore the drop in output since it is not immediately noticeable and proceed with the exam. D. Perform an alternative imaging procedure such as ultrasound to ensure adequate results. Answer. Correct answer. B. Cease the procedure immediately and report the issue to the lead radiologic technologist. Explanation. If there is any doubt about the equipment's performance, safety, or output, the procedure should be halted to prevent potential overexposure to radiation or suboptimal image quality. Reporting the issue immediately is crucial to ensure that the equipment is thoroughly inspected and repaired if needed. Ignoring the issue or continuing with addressing it would not be responsible. Question 25. Dr. Patel is concerned about the potential radiation exposure to patients during fluoroscopy. Which of the following measures would be the most effective in reducing the patient's exposure during the procedure? A. Increase the fluoroscopic beam size to cover the area of interest more effectively. B. Use the highest available radiation dose to ensure optimal image quality. C. Minimize fluoroscopy time and use pulsed fluoroscopy to reduce exposure. D. Maintain constant exposure rate throughout the procedure. Answer. Correct answer. C. Minimize fluoroscopy time and use pulsed fluoroscopy to reduce exposure. And explanation. The most effective way to minimize radiation exposure during fluoroscopy is to reduce the duration of exposure and use pulsed fluoroscopy, which delivers intermittent radiation instead of a continuous beam. Increasing the beam size, option A, and using the highest dose, option B, would actually increase exposure. Constant exposure, D, should be avoided for safety. Question 26. Which of the following is the primary goal of the ALARA principle in radiation protection? A. To ensure that the dose of radiation is kept as low as possible while still achieving diagnostic image quality. B. To completely eliminate any risks associated with radiation exposure. C. To maximize the effectiveness of imaging procedures regardless of radiation dose. D. To provide the highest possible radiation dose to ensure clear imaging. Answer. Correct answer A. To ensure that the dose of radiation is kept as low as possible while still achieving diagnostic image quality. Explanation. The ALARA, as low as reasonably achievable, principle is focused on minimizing radiation exposure to patients and workers while still obtaining the necessary diagnostic information. It does not advocate for eliminating radiation, option B, maximizing radiation dose, option D, or ignoring considerations for clarity, option C. Question 27. In a radiation therapy setting, which of the following is a primary factor in determining the dose distribution of radiation delivered to the tumor? A. The linear energy transfer of the radiation used. B. The energy of the radiation beam and its ability to penetrate tissues. C. The amount of scatter radiation produced during treatment. D. The number of radiation beams used in the treatment. Answer. Correct answer. B. The energy of the radiation beam and its ability to penetrate tissues. Explanation. The energy of the radiation beam is a key factor in determining how deeply the radiation can penetrate tissue and the dose distribution within the tumor. High energy beams are typically used to treat deep tumors. The linear energy transfer, option A, is important in determining biological effects, but does not directly affect dose distribution. Theta radiation, option option C, and beam number, option D, are secondary considerations. Question 20. Which of the following best describes the purpose of a dosimeter in a radiology department? A. It measures the radiation dose received by a specific area of tissue. B. It monitors the total radiation exposure to patients during an imaging procedure. C. It tracks the radiation dose received by radiologic technologists and other personnel. D. It records the energy level of radiation produced by an X-ray machine. Answer. Correct answer. C. It tracks the radiation dose received by radiologic technologists and other personnel. Explanation. A dosimeter is used to monitor and record the radiation exposure received by personnel working in areas where ionizing radiation is present. It does not measure the dose to patients, option B, or specific tissues, option A, nor does it measure the energy level of the X-ray machine, option D. Question 29. When performing radiation therapy on a patient, it is crucial to accurately calculate the dose delivered to the tumor while minimizing the dose to surrounding healthy tissues. Which of the following technologies is most commonly used to achieve this goal? A. Intensity modulated radiation therapy IMRT. B. Stereotactic radiosurgery SRS. C. Brachytherapy. D. Digital radiography. Answer. Correct answer A. Intensity modulated radiation therapy IMRT. Explanation. IMRT allows for the delivery of high doses of radiation to a tumor while minimizing exposure to surrounding healthy tissues by modulating the intensity of the radiation beams. SRS option B and brachytherapy option C are also used for precise radiation delivery, but in different contexts. Digital radiography option D is not a form of therapy but an imaging technique. Question 30. Which of the following is an example of a stochastic effect of radiation exposure? A. Skin erythema caused by a high dose of radiation. B. Hair loss following chemotherapy. C. Increased cancer risk due to long-term low-dose radiation exposure. D. Cataract formation caused by direct radiation exposure to the lens of the eye. Answer. Correct answer. C. Increased cancer risk due to long-term, low-dose radiation exposure. Explanation. Stochastic effects, such as cancer, occur randomly and the probability increases with dose but without a threshold. The other options, A, B, D, describe deterministic effects, which have a threshold below which no effects are observed.